Okay, just come back. I would love to have, James, if you also want to put up your camera. Here. Maybe some books should be in the third room.
As much as you can. But your arms don't hit the wall. Can you push your butt back against the wall also? There we go. Just try to keep as much as you move your arms.
Sure. Yeah. Or I can introduce myself. Hello, Carol. Well, either or. Share. And I did make a an outline for my for what we're talking about today. Did anybody get that, or have we emailed that? Okay.
That comes out on Facebook.
Okay. 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 I should have, hang on. I should have, can you find more books, please? Thanks.
More books.
Like in the third room underneath the desk. Or underneath, like in there. Okay. Where is our chat box? Chat, yes. I've not updated my computer yet. Okay, so I just posted in the in the chat box kind of an outline of what I'll be talking about right now. If you guys want to, there's a couple of notes on there too. And maybe it'll help clarify some things for everybody. And I will always take questions, or I'll ask for questions during and after. So don't be shy. Thank you.
No, that's too high.
There, perfect. Just so it's a little bit more. Oh, I just realized those that just entered, you might not get, here I will post this in the chat again. Okay, we will start. So I'm gonna ask if everyone can mute, oh, go ahead. Or were you about to, okay. You're good, okay. If everyone can mute their screens, definitely please unmute if you have any questions. But just so we don't get any, there, I just muted a couple of you guys. Okay, hello. My name is Cassie Chonko, and I'm a doctor of physical therapy at Body Balance in Lakeway off of Loman's Crossing. And I don't think any of you guys look familiar to me, but I usually do workshops on knee pain and osteoarthritis, posture and core, so a bunch of different things, as do my colleagues. So I'm glad to see everyone here. Today we're talking about heel pain and plantar fasciitis. So just to jump right in, what is the plantar fascia? Fascia is just like it can be any type of tissue, but just like if anyone has heard of like your IT band, how that can get tight, that is the same type of tissue that's on your plantar fascia. And you can see how I kind of drew a triangle on this foot on my screen, and then I'll show you right here. So it's this thick tissue that runs from like the balls of your toes and to your heel. And it helps with kind of springing your foot as you're walking. But what can happen after time, either from overloading or like just being on your feet for too long or anything that overloads the plantar fascia, that's what can cause irritation in that plantar fascia. And plantar fasciitis just means anything with itis or like tendinitis, neuritis, it's just inflammation of. So that's more of an acute stage, or something like for instance, if a couple weekends ago I went on a really long walk, like I walked all day, and then the next morning, like my heel hurt for a couple days just because my plantar fascia got a little bit irritated. But over time, if you don't address it properly, then that tendinitis can just kind of become more chronic and more of a tendinopathy. So you can either get inflammation in the plantar fascia acutely, or then over time you might get bone spurs. But that doesn't necessarily mean that that's a bad thing, but just your body just wants to build more tissue to try to support it. So that's something that can happen. But the hallmark sign of plantar fasciitis is if you have heel pain or pain in the inside of your arch right away with your first step in the morning. So either a first step in the morning, or after you've maybe sat and watched a movie for a couple hours and you get up and you have heel pain. And then typically it'll get better as you start to walk it off. So what we will do, or everything that I'm explaining today, is based off of the most up-to-date research on what has shown to improve your plantar fasciitis. So the good things, or at least kind of in order of importance: manual therapy, so doing a lot of hands-on therapy. If you come to physical therapy, like stretching out your plantar fascia and kind of relaxing the tissues and making them feel more less painful will be a good start. The other thing, it doesn't necessarily have to be a fancy insert, but just kind of like a regular insert to support the arch of your foot. That has good research behind it. Something else in terms of shoe wear, I get asked a lot if like what shoes are the best shoes to wear. Really any shoe, but as long as you're alternating them. So not wearing the same shoe every day, but some shoes one day. So just alternating your shoes, or getting a rocker bottom shoe. So it's kind of like a curved bottom, so as you're walking, it doesn't, sorry, someone just joined in. It doesn't irritate your heel pain. Barbara, do you have a question? No, I just saw that you went unmuted. Dry needling is also good. So kind of using acupuncture needles. And so all of these things that I'm discussing are things that we can do to help your pain. But then what we need to do is actually fix the cause for why your plantar fascia got irritated in the first place. So whenever I'm saying with internal interventions, stretching, if our heel, when we walk, isn't flexed, or if the range of motion, if your ankle doesn't move into this direction, or kind of or this way, or in my picture right here, going into this direction, that's going to put extra tension in through your plantar fascia. So getting to have more range of motion into this direction, dorsiflexion, is really important to take the load off of your plantar fascia. So we need to start by stretching first, and then moving into loading the tissues and by strengthening. So a basic calf stretch, what I like to do, and I will show you here, is if you take a small towel roll like this, or I just have a roll. And if you place it on the floor and put your, here we go. Can you see my foot? Okay. So what this is doing is stretching the back of my calf, but it's also stretching the underneath part of my foot, which is where the plantar fascia lies. So in order to get that to have more of or if your plantar fascia isn't stretching as you're walking, taking a step, then every time that you take a step, it's just kind of loading too much through your foot. So that's my favorite way to stretch the plantar fascia, and also stretching your calf. There's good evidence to support also if you have a night splint, stretching your foot into that direction. That might not be something that you can get by yourself. You might have to go to your doctor. But something else that the evidence supports is having night splints to put your foot into that position. And then the other thing, so as we're starting to improve the tolerance to stretching the plantar fascia, or the bottom of your foot, we then need to work on the strengthening of the muscles on the inside of your feet, and also just around your ankle, and also just kind of up the entire leg. Something that people don't recognize, a lot of times if you have bad posture in your hips or in your knees, where your feet cave in or outwards. So again, if I show right here, if my legs cave in, or if I have kind of like bow knees or knocked knees, you can see how that changes the position of my foot. So imagine all of this is caused over time with your plantar fascia if you're putting too much load through your foot. So if you're walking a lot, but then also you have this kind of caving in of your knee and your hip, that's putting extra pressure through the bottom side of your foot. So what I look at as a physical therapist is to make sure that we correct the strengthening, or we correct those imbalances and make your muscles stronger to hold your foot in a more neutral position. And I see a lot of, this kind of goes hand in hand with knee osteoarthritis. A lot of times if you have knee OA, you might have a bowing of your legs, so your knee's going out in the other direction. So that's something to consider in terms of, once we fix the pain, we need to make sure that it doesn't come back. So stretching your foot into this direction, or stretching your calf in the bottom of your foot, working on the strengthening of the rest of your legs. And then my favorite to do is strengthening the muscles on the inside of your feet. This is really tricky, and I was just working on this with one of my clients before I got on with you, is toe yoga, or making sure that you can trying to isolate moving your toes to strengthen the inside of your feet. And it sounds crazy, but it's kind of hard to connect your brain to those muscles, because for so long, if our feet are smushed in shoes, it's really hard to then start to wake up those muscles. But we need those muscles on the inside of the foot to help strengthen the arch, to then take pressure off of the plantar fascia. So, I mean, if everyone can try, I don't need to watch your toes, but even if you're just sitting, lifting up all of your toes onto, let me see if I can. Here. Okay, so if we all just lift up all of our toes, kind of just like this, which is, yep, lifting everyone up. But now if you can just put leaving the rest of your toes down and just lifting up your big toe. Or vice versa, keeping your big toe down and lifting up your other toes. It's hard to do. I will be surprised if anyone can do it on their first try. If you can, you get a gold star. But trying to, again, isolating those movements will help get better awareness into the foot so that then those muscles, if you don't have good awareness of the muscles, then it's hard to strengthen them. So first we kind of have to get an understanding of how to work those muscles, and then after that we're able to strengthen them with much better accuracy. We can, and this applies to any exercise, is that if you are, you can do a bunch of different exercises for any body part, but if you're not targeting or if you're not feeling the fatigue working in that muscle that you're trying to strengthen, then it's not doing anything for you. So getting good awareness of how your body works, and specifically with this, how your feet work, is really important. I think that's all I have for now. I did go into, I will say, and I don't like to dismiss other treatments, but the most recent evidence does say that ultrasound does not help. So if anyone goes to, not ultrasound to like check for pregnancy, but sometimes you can use ultrasound and it kind of gets warm and it's supposed to help with pain, but that is not a good, that's not an evidence-based intervention to help with your plantar fasciitis. So I just wanted to touch on that. Does anyone have any questions or need me to clarify that stretch or any other exercises that you've looked up on the internet maybe and are wondering about? Mm-hmm. 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 Yeah, exactly. So I'm very much, and everyone is different on a case-by-case basis. But if it's something that you have not used in the past, would much rather have your body be able to hold your feet and not get an external support. So that's why you can just use, and the research supports pain relief for, I want to say either 1 to 3 months with orthotics. So even still, you might get the orthotics, and then if you don't do any of these other internal interventions in terms of stretching and strengthening, then it's just going to kind of come back. So to answer your question fully, I would prefer using orthotics maybe for a little bit for pain relief, and then trying to wean off of it. But that's where we have the other alternatives in terms of, I do a lot of taping, so I can tape the bottom of someone's foot to kind of unweight or kind of add a little bit of cushion onto the plantar fascia. And then also alternating your shoes. But no, it's not something that I want you to use full time, just because then you're dependent on something. Mm-hmm. Correct. Yes. But the downside of the tape is that it comes off. So, and then you have to retape yourself. Yeah, but good question. And that's So whenever I say the orthotics to support the medial arch, so that's the, I'm going to try to show my foot again. The regular location that I normally do these workshops was taken by another therapist, so that's why I'm a little bit back and forth with my camera angles. So let's see, here we go. Okay, so the medial arch is the inside of your foot. So you're wanting to support in through here, kind of from the side, in the front, this way. This also, or if you tend to have an increased pronation or your foot tends to fall in repetitively, that also, going back to the position of the knees and the hips, if my knees and hips cave in, then you'll see that the inside arch of my foot also flattens out. So if we can also, not only just with the orthotics, but by strengthening to put you more into this position of a better alignment with your knees, hips, and ankles, then that will also help improve the maintenance of your medial arch. Yeah, and that goes a lot with knee issues. So I mean, the knee bone's connected to the foot bone, or that whole chain. So a lot of times with arthritis, people will have bone knees, or that's more common than knock knees, and then that will affect how the ankle lies, and then the stresses that go through the ankle. So as a physical therapist, that's what I'm looking for when someone comes in with, specifically with heel pain. It's what does the knee look like, what does the hip look like, and then maybe even sometimes your back. So all good things. Thank you for those questions. Anybody else? I love answering questions. Yeah. Yes, please. Yeah, and the floor, my sock is dark and the fluid and the floor, yes. Okay. Okay, yeah, my pants are black, I know. It wasn't a good option. Well, the tight pants then helped with being able for you to see my legs. That was my thought this morning. So yeah, the towel is dark. So all I'm doing is, this is a couple inches thick, or really, 1 or 2 inches thick. It's going underneath my toes and my heel is staying on the ground. So my foot is technically in this position. So here's my foot is flat and this is my toes being up. And then I'm placing the towel right underneath the ball of my toes. And then I'm just taking a step right next to my foot. Can you see? Okay. Please. Yep. Yeah, rolling the bottom of the foot, that's just kind of, so ice and heat kind of work the same way in terms of pain relief. It just gives the brain something else to feel. Or if you are in more of those acute stages where there is some inflammation, that might be helpful to use something with ice. But just rolling the bottom of the foot is more so just like massaging, similar to doing manual therapy. So doing some soft tissue work or mobilizing the joints in your foot. But no, I would say that that's not really stretching your calf or stretching your plantar fascia. So that still is a good, yes, yeah. No, whoever just asked that. No, you just kind of step and hold. And I would say for a good 2 minutes. And I just want a gentle stretch. It should not be, and this is, I see people stretching often or at the gym and obviously when I'm working. And if you're stretching to the point of where it's not a comfortable stretch, but it's kind of straining, then your body wants to tense up and resist the stretch that you were trying to accomplish. So if you're stretching too aggressively and you're fighting yourself, then you're just kind of not doing anything because you're not letting your body relax into that position that you're trying to go to. So with any stretch, you should feel a stretch, but it should be comfortable where you don't feel like you're holding your breath and counting down the seconds to finish. Does that make sense? Yeah. So, and the reason why we are stretching is again to apply some, or to put some load through the plantar fascia, and then moving on from there, doing exercises such as heel raises or single leg heel raises, or going down slowly onto your heels. So kind of when you go up and down on your toes like this, which will tension the back of your foot or the underneath side of your foot and make it more stronger and resilient to forces. Oh, I realized I have 2 new messages down here. Oh, that would have been a good suggestion. Sue said to stop sharing my screen so you guys can see me. I wish you said that earlier. Do you need me to demonstrate the stretch one more time? I'll do it one more time just for funsies. Here. Okay. Oh, is this any better? I'm not sure. Okay, here, so small towel roll, and then my toes are on the towel roll and my heel is staying on the floor, and then I'm taking a step forward to feel a stretch in the back of my calf, or my calf and Achilles, and then maybe into the bottom of the foot. If you don't feel a stretch, then maybe make it a little bit higher. Something else to keep in mind is to make sure that your hips are not forward like this, but stand up all the way tall so that you're being mindful of having good posture. But that's a whole nother conversation. That's a different workshop. Posture. So the other thing that is important to note, and this is why we need to go to a physical therapist first, is making sure that the pain, if you guys are having, I'm assuming you guys are here, because you have some sort of a foot pain. It's not always going to be plantar fasciitis. There are other diagnoses, and that's what my job is to rule out by testing the different structures in your foot to make sure that we are treating things appropriately. So not all foot pain is treated the same. You might have some nerve pain going on, or possibly some Achilles tendonitis or Achilles tendinopathy that also can present as a little bit of heel pain. Some nerve irritation also can present as heel pain or pain on the inside of the arch. So I would recommend to either come see me or a different therapist, or go to just any physical therapist. Medicare does cover physical therapy, and we're at the end of the year, so hopefully people also maybe have met their deductibles if you have private insurance. So, any other questions? Pam, thank you for your questions. Everyone turned off their screens. I cannot see anybody. Oh, it was Emily. Yes. Oh, okay. The other thing is, does anyone have any, so I started doing this workshop because it was, someone asked me to do a workshop on plantar fasciitis. So are there any topics that anyone is interested in learning about? I'm always open to doing new workshops. I think the best thing that I can do for my clients and my patients in the community is teaching you about your body. So if you know kind of how to recognize things, and you're able to change it. Oh, two people, question and something else. For sure, yes. I see bunion, thank you. How did I forget that diagnosis? A lot of times bunions present, so it comes onto this toe. And I will say that, like, I have a little bit of a bunion forming on my right foot. Am I doing anything about it? No. But should I? Yes. So they present kind of at this joint right here, but actually where it comes from is if this bone, so if you have flat feet and this starts to go downwards, that kind of puts more pressure on the outside of your big toe joint. So I can't fix it. A lot of times people will get surgeries to kind of shave off the bone, but again, that's not fixing the problem. It's just aesthetically changing it. It might help with pain if that bunion keeps rubbing on the inside of your shoe, but it's not fixing the problem. So addressing the mobility of this joint, your TMT, or you might have other stiffness or laxities in the rest of the bones of your foot, and then strengthening and working on controlling your arch. And then again, going back from what Emily was, what I was addressing with Emily's question, making sure that the rest of your leg has good control so that your feet don't fall in and then cause that extra pressure onto the big toe. Yeah. Well, what the cause is, it's gonna depend on with everybody. But making sure, or what good posture is, and this is what I touch on in my posture workshop, is we want to make sure that all of your bones, so when you're building a house, you want the weight to go through the support beams, not the drywall. So your bones are your body's support beams. So we want to try to stack your bones up, or what good posture is making sure that all of your bones are in good alignment or stacked up so that they're kind of resting, or gravity is just kind of holding you, as opposed to if you're slumpy like this, which also I do this for a living and I don't have perfect posture all the time, so that's okay. But if you're living in this position where the weight of my head isn't stacked on top of the rest of my spine, then that is going to start to cause other things to pull or have to work more, and then some other muscles then get lazy. So applying that same concept to your entire spine and posture of getting your weight equally distributed, it's kind of that's a whole other thing. I don't know how else to explain that quickly. But in terms of good foot posture, when you're standing and when you are exercising, having equal weight between the ball of your big toe, ball of your pinky toe, and your heel. So like your foot is like a tripod. So we don't want to have too much weight on like the inside of your foot. So if you're overpronating, or we don't want it too far here, or we also don't want too much weight on your heels or toes. So think about the weight that you put through your foot as a tripod, so that again, all of the forces are kind of equally distributed through your whole foot. Yes. For in terms of the other postures, it's gonna, that I can't blanket statement that it's gonna depend on everybody, but I love it. I love the question. And if someone might have like one leg longer than the other, or if someone has like their hips off balance, yes, that also can change the way that your legs lie and that where the load is going through your foot. So it's going to be on a case-by-case basis. See a physical therapist. See a physical therapist. Yeah. Yeah. Mm-hmm. Exactly. Yeah. And the thing that I work with a lot of my patients are seeing chiropractors. I don't have anything against chiropractic care, but what is important and what I will follow up my adjustments or manipulations with is making sure that we train the body how to keep that alignment. So if someone puts you into alignment, but then you walk out the door and your muscles are used to working in a certain way, then they're just going to go back to working that way. If your leg is literally longer, like the bone is longer, there are things that we can do, but a lot of times it has to do if someone's hip is like hiked up. So imagine someone that if you were a new mom, or you were always a mom and you kind of always held your kid on this side of your hip, then that kind of hikes this up, which then, I'm not going to show you my leg, but my leg is not touching, my foot isn't all the way on the floor. So it seems like this leg is longer, but actually I've just hiked up this part of my hip. So checking to see how the back looks and the pelvis will influence everything down chain. But I appreciate that, just because that's a hard thing to understand sometimes when people come in just with pain in their foot and they say, wait, but why are we looking at my back? So, any other questions? No? Or any other topics that anyone is curious about? Pam, thank you for the bunion. I probably won't do a whole workshop on that, but I should add in bunions onto, because a lot of times bunions can come up with plantar fasciitis just because of those imbalances in the foot. No? Nothing else? Oh, okay. Uh-huh. Mm-hmm, mm-hmm. Like the ball of your small toe? Oh, but what about the ball of your foot? Yeah, so but you probably have some claw toes or hammer toes, so sometimes when, here we go, here's the baby toe. So when you have an imbalance in some of the bigger muscles from your leg, it can pull your toes up and kind of make them look like claws or hammers. Something that I didn't mention, but is in my little, I think it should be in the thing that I sent you guys. Getting toe spacers. So working on maybe trying to spread your toes out, and that will help with strengthening the muscles on the inside of the foot. But in terms of the tripod with the foot posture, it's the ball of the big toe, the ball of the pinky toe, and the heel. So yes. Yeah. Come see me. Yeah. Thank you everyone for showing up. Yeah. Oh, I lost you, Sue. I can't hear you, Sue, but that's okay.
Done?
Yes. Okay. Yes, you're welcome. Thank you, Emily.